World over, there are about 10 to 20% of people who suffer from depression in one's lifetime. In this short film, you see a young doctor preparing for PG entrance exams who suffers depression and combats it. The young doctor's routine begins early in the morning at 5 a.m. He exercises regularly to keep himself fit and fine and has a few hobbies to relax. Begins his studies early morning with enthusiasm. He has a timetable to keep up. He studies all subjects methodically with references, takes notes of important points, does revision regularly. As the days progress and the exams are approaching, he starts losing interest in studies, gets stressed up, finds difficult in focusing on studies as planned earlier. Has difficulty falling asleep and wakes up intermittently, loses hunger and food doesn't taste good, becomes dull and inactive. He has no enthusiasm left. He feels too weak and tired. Prefers to be alone in isolation. Later, he becomes unable to engage in his earlier enjoyable activities. Finds it difficult to concentrate and study. Has lost his confidence. Becomes restless and gets easily irritated. Is much worried about salvaging the situation. He neglects caring himself. He has lost hope and worried about future. Doesn't find ways to come out of the situation. He is in a dilemma. Suicidal thoughts appear in his mind but resists them. At one point of time, he decides to commit suicide, makes a death note, and when he was about to gulp a heap of tablets, he gets reminded of his family. And drops the idea of suicide. Consulting a psychiatrist is the best way to come out of depression. Psychiatrist does a physical, mental, and laboratory examinations, does evaluation of severity of depression using a questionnaire. During consultation, one should express their feelings and difficulties without any hesitation to find an amicable solution. In depression, one has negative emotions which should be neglected and the positive ones be nurtured. One should utilize the potentials within oneself to the optimum. This brings a positive change in the behavior and attitude. In the counseling session, psychiatrist teaches about stress management, coping skills, supportive psychotherapy, and other suitable therapies. Prescribes medications required. One needs to follow the advice strictly, take medications at right time, right dosage, and right duration. Having a healthy diet, right support from friends and family members, involvement in sporting activities helps in speedy recovery. Follow-up consultation with psychiatrist is very important to make an assessment of improvement or worsening of the condition or appearance of new problems which are to be managed appropriately. After a few days of treatment, they can visit places of interest and de-stress themselves. Practicing yoga, meditation, and relaxing exercises regularly increases attention and concentration, boosts self-confidence. Involving in daily sporting activities helps in release of feel-good hormones like endorphins, serotonin, and dopamine, which helps in uplifting the mood and enthusiasm. It is very important on part of the family members to care patients with love, compassion, and empathy, which improves their self-confidence and motivates to discuss their problems and enhances problem-solving skill. They should also encourage to realize the potential and achieve greater heights. It is important to observe for suicidal thoughts, preparations, and attempts. Family members should ensure medication adherence and follow-up treatment. According to World Health Organization, health is defined as physical, mental, and social well-being, and not mere absence of illness or infirmity. In this background, mental health plays a very important role in one's life. Identify signs of depression early and treat them early. Save human life and suffering. Join hands for a humane cause.